I'm Mariela. We've partnered with GSK to raise awareness about endometrial cancer, or EC, a serious type of gynecologic cancer. As part of those efforts, GSK has partnered with Shakeya Allen, an endometrial cancer patient survivor, a patient advocate, and founder of the Uterine Cancer Awareness Network, UCAN. Shakeya recently hit the streets of New York City to find out just how much people really know about the risks and symptoms surrounding endometrial cancer.
Hi, I'm Shakeya Allen, the founder of Uterine Cancer Awareness Network. Let's face it, we all have questions we're too embarrassed to ask, especially when it comes to our bodies. Gynecologic health can be even harder to talk about. I mean, painful urination, random vaginal discharge aren't exactly subjects casually mentioned at brunch. Today, I'm partnering with GSK to hit the streets of New York City to help break the silence and raise awareness about a specific gynecologic disease on the rise, endometrial cancer, which I myself was diagnosed with in 2009. Let's break the silence, shake off the stigma, and get you the support you deserve.
Shakeya, welcome and thank you so much for joining us today.
Thank you so much for having me.
So tell us, what was your experience like?
It was an eye-opening experience, I'll tell you. Aside from the fact that I found out that no one can fold a fitted sheet, I did learn that there is a lot of work to be done in order to educate people about endometrial cancer, which is a gynecologic disease that affects tens of thousands of people every year here in the U.S.
And that brings us to why we are here today. In addition to empowering people to recognize the risks and symptoms of endometrial cancer, we are working with GSK to break the silence, shake off the stigma, and openly and honestly discuss gynecologic health without being embarrassed. Let's meet our panelists here today. We have Dr. Bhavana Pothuri, a gynecologic oncologist with NYU Langone Health here in New York City. We have Hattie, an endometrial cancer survivor and advocate with Endometrial Cancer Action Network for African Americans, frequently referred to as ECANA. And we have Denise, an endometrial cancer survivor and advocate with the Uterine Cancer Awareness Network, UCAN. And of course, Shakeya Allen, who we just met. Thank you all so much, ladies, for joining.
Thank you.
We're going to watch and react to a few clips from our days on the street. I want you all to feel free to jump in at any point. We want this to be an open and honest discussion. Okay? Are you all ready?
Sure.
Yes.
Roll the tape.
What's something you're embarrassed to admit you don't understand about your body?
Whether I'm in peri or full menopause.
Do you know the difference between menopause and perimenopause?
Yeah, a little.
Menopause is when you have went 12 months without a period. Perimenopause is the phase leading up to menopause.
Oh, okay.
That was a short clip, but it sets the scene for an important topic of discussion: menopause misconceptions. Dr. Pothuri, are you surprised by these reactions?
No, I'm not surprised at all. Many of my patients are confused. They don't know the difference between perimenopause, which is the time leading up to menopause, versus menopause, which is defined as 12 months where you don't have a menses or period. So during this time, there are significant hormonal changes during perimenopause, which leads to very irregular bleeding, sometimes very excessive bleeding. And so when patients actually transition into menopause, it's very difficult and confusing to them to really understand whether that's abnormal. So it's so critical that you pay attention to your body and understand what these differences are between perimenopause and menopause.
Why are so many women misinformed?
I think it's because historically women have not been empowered to talk about these signs or symptoms, and I think it's becoming more acceptable now where women are talking about their bodies and what they're experiencing. So I think we're seeing that shift, which I think is a very positive one.
I can only imagine if we're not talking about menopause enough, then we're definitely not talking about endometrial cancer enough. Let's watch another clip, shall we?
Do you know what this body part is?
I know that's the uterus, but not sure what that specific part is called.
That is the endometrium, which is the lining of the uterus. It builds up over a course of your menstrual cycle in preparation for pregnancy. If none occurs, then it sheds during your period. But unlike your period, this part of the body does not go away after menopause. If that endometrium builds up over time, it could cause endometrial cancer. Have you ever heard of endometrial cancer?
Yes.
No.
Endometrial cancer is the most common form of gynecologic cancer in the United States. There are about 62,000 new cases estimated to be diagnosed in 2025. That's more than 160 women every single day.
That's a lot of women.
Which of these could be a sign of endometrial cancer? Spotting or light vaginal bleeding after menopause, new or unusual vaginal discharge, or persistent pelvic pain?
Probably the pelvic pain?
Yes. However, that was a trick question. All three of those can be signs of endometrial cancer.
Some of those symptoms sound like menopause.
They do. That's why paying attention to symptoms matters at any age. While irregular bleeding is common during perimenopause, it should still be discussed with your doctor, though abnormal vaginal bleeding can also result from non-cancerous conditions. For any bleeding after menopause, even light spotting, you should tell your healthcare team immediately.
I didn't know that.
Shakeya, let's start with you. Were you surprised by the reactions of the people you interviewed when asked about endometrial cancer?
I wasn't. There is a huge knowledge gap when it comes to endometrial cancer in people with uteruses. For example, a lot of people believe that when they have their yearly pap smear, that it is testing them or screening them for endometrial cancer. Now, when I do my seminars, I always start by asking everyone in the room, how many of you all have been screened for endometrial cancer? Almost every single hand goes up. And then I have to let them know that I hate to be the bearer of bad news, but you did not receive an endometrial cancer screening because there's not one that exists.
Dr. Pothuri, can you give us a quick overview of endometrial cancer?
Sure. Endometrial cancer is a cancer that originates in the lining of the womb or uterus. It's the most common gynecologic cancer in the United States. It's estimated that over 62,000 women are impacted by endometrial cancer in 2025. That's 62,000 individuals diagnosed with endometrial cancer. That is not a small number. And that's why it's really important that we understand the signs and symptoms. And that's why, listen to your bodies, think about these signs and symptoms, and advocate for yourself.
Denise, would you mind sharing a little bit about your story, please?
Sure. So my mother had endometrial cancer at 50, but we didn't really talk about it. So I wasn't aware of all the symptoms. She was diagnosed in menopause, and I got my diagnosis prior. Was not in menopause, and so I didn't know any of the symptoms. So I didn't know what to ask or nor what to look for. I guess I was in my late 40s. I started to notice that my periods were very, very heavy, and I was having incredible menstrual cramps. But as it was happening, I've had menstrual cramps most of my life, so I just thought, all right, this is just a continuation of it. But the bleeding was nonstop, and it just kept getting worse and worse. So I went to my doctor, and we talked about it, and she said, this is, you're approaching menopause. This is very common. Your periods are going to start to get irregular. And then I started to get additional symptoms, like the watery discharge, and I was getting bloated, and I was just continuing, and the bleeding just got incredibly worse. Finally, I just clearly remember one day I was on the beach with my family, and I was at my wit's end. I just, and I shouldn't say, I have to give credit to one of my daughters, because she was constantly, Mom, she's in the medical field. She's like, go get a hysterectomy, get it. And I was just waiting for my doctor's approval, right? I just didn't know to say, got to the point where it was so disruptive in my life that it really affected my day to day, that I finally was like, that's it, I'm done. That Monday, I called the doctor and I said, I want to have a hysterectomy. And she agreed. She said to me, before we plan this, I want you to have an ultrasound. I went and scheduled the ultrasound, and a week before the ultrasound, my appendix ruptured. Wow. And so I went into the emergency room, and based off of that is when I got diagnosed with endometrial cancer. It was stage 1, grade 3. From there, I had to have hysterectomy, full hysterectomy, and then followed by chemotherapy, radiation, and also brachytherapy. All this was during COVID too, so you can imagine. You can imagine what it was like for being diagnosed with cancer, but then for you, the patient, but also you don't realize how it affects your family, and for them not to be able to come with me, I just remember my husband being so upset that he had to drop me off and then couldn't stay with me. So I had those challenges, and I think I don't want to get upset, but just seeing my family's face and reaction to when you have a cancer diagnosis like that was hard for me, but harder for them, mostly because they couldn't be with me during COVID. Yeah. So anyway, sorry, I don't mean to be sad, but because I was fairly young, a genetic doctor came in and said, hey, we think you ought to do some genetic testing. And sure enough, I got tested and I was positive for Lynch syndrome, which is a disorder that just makes patients more susceptible to certain types of cancer. And based off of that, their recommendation was to go back to my family and have my family tested. 14 of us were tested, 13 of us were positive, including both my daughters. I'm super, we are very open about it. It was a very scary time for us because we just didn't know a lot about endometrial cancer. We didn't know anything about Lynch syndrome, but fast forward, it's been 5 years, and both my daughters and I are under the same care, the same Lynch specialist, so we have a plan.
During Shakeya's time out on the streets, she spoke with a mother-daughter duo that we hope will have open and honest conversations one day like the ones that you and your daughter are having. So let's roll that clip now.
Who is more at risk for endometrial cancer, you or your mom?
My mom, I guess?
Correct. Most cases are in postmenopausal women, but it can happen earlier too. I myself was diagnosed before I went through menopause, and the rates of this cancer have been increasing, including in younger women. That's why it's super important to listen to your body, because no one knows your body like you know your body.
Period.
Hattie, we'd love to hear your thoughts about the mother-daughter video we just watched.
Well, I have 3 daughters, and from birth, I've really talked to them about everything and anything. So it's very important for me as a mother to share with them my thoughts on their body, right? So from an early age, I did that. And I still do that. And they're grown women. Now they just look at me like, Mom. But I do what I have to do.
Dr. Pothuri, can you talk to us about what Shakeya mentioned about the rates of endometrial cancer increasing, including in younger women?
Yeah, that's a really important point because we are seeing endometrial cancer in patients who are younger and younger, and that's related to 2 things. The obesity epidemic, where we are having excess estrogen that stimulates the lining of the uterus. In addition, we're also seeing increase in PCOS, or polycystic ovary syndrome disease, which also causes this excess estrogen and buildup of the lining of the uterus, which puts individuals at risk for endometrial cancer.
Shakeya, can you talk a little bit more about what you touched on in the video about your own personal experience, please?
Sure. What I was pointing out there is that most women that are diagnosed after menopause. Myself, I was diagnosed prior to menopause. And so I was diagnosed in 2009. The only reason I received that diagnosis is because I had a pregnancy in 2008 that resulted in a miscarriage. And at that point, they had to do the workup and they got the stuff sent over to pathology. And I found out that I had cancer cells within that endometrium. And that's how I was able to get my diagnosis.
Wow, what a journey it's been for you. Thank you so much for sharing today.
You're very welcome.
Hattie, we'd love to hear your story, please.
I am a 2-time breast cancer survivor, and have been through quite a bit over the last, I'll say, 20 years. After the first diagnosis, it was 11 years later, totally different type of cancer. And then this year, I was actually diagnosed with endometrial cancer. And to the doctor's point earlier, it's so important to know your body. No, I was not bleeding. I was actually experiencing a clear discharge, but I knew it was abnormal. So I was able to go to the doctor, and she was wise enough to order the necessary tests and then follow it up with a biopsy to be diagnosed with that. So I'm grateful for that.
You must know your body. You cannot be afraid to speak up about anything that goes on. The doctor cannot help you if you don't know what's happening, if they don't know what's happening.
Agreed.
100%.
Now let's have a little bit of fun. Shakeya hit the streets of New York City to find out what people were saying embarrasses them the most. Let's watch what they had to say.
How do you feel about peeing in the shower? How often do you wash your bra?
I don't know, maybe once a month. Is that gross?
If it is, I'm about 2 weeks behind in laundry. Would you mind sharing something you're embarrassed to admit that you don't know?
How to fold a fitted sheet?
How paper checks work.
I don't know how to drive a stick shift.
No biggie. I don't remember how to parallel park.
I can't even drive.
Hattie, what do you make of what you see here?
There are a lot of things that people are embarrassed about, but the one I guess that stood out was the one that Shakeya had mentioned earlier. She mentioned the fitted sheet, and we were all like, huh? But we see now, the gentleman was talking about that was an embarrassing thing for him because he doesn't know how to fold a fitted sheet. But he's not alone because I don't either. I take it out of the dryer and I kind of roll it up a little bit and then I kind of throw it in where it belongs. So we are here today to talk about endometrial cancer, and there's really no reason why anyone should be embarrassed about it. And if you're experiencing something, you should be willing to talk to, the doctor or yourself or your family members about the situation, because it could save your life, right?
Right.
So that's important.
Absolutely.
Yeah, and then, another thing to add is, to be yourself an advocate, right? Because when I was going through this, I didn't get the support that other cancer survivors received. So I was challenged in the middle of COVID too, to try to find support, to try to get help. And fortunately, I came across Shakeya and her foundation, but that got me through a lot during that time. But yeah, so support and advocacy is so important.
Shakeya, talk to us about the support you experienced when you were going through everything.
In 2009, it wasn't even a subject that was talked about. I had no idea what endometrial cancer was until the day of my diagnosis. And so I made the decision that if I made it through this, I was going to make sure every single person I knew or ran across knew about endometrial cancer. And that's why I'm here today. And that's why I am so thankful for this partnership.
We've talked a lot about symptoms and risk factors and even had a few laughs along the way. But on a more serious note, let's take a look at this clip where people are learning about survival rates.
Waiting too long to recognize symptoms can seriously impact outcomes. People that are diagnosed early have a 95% chance of surviving the cancer for at least 5 years. Can you guess the 5-year survival rate for those who are diagnosed with distant endometrial cancer, which means that it's spread?
40%?
Even lower.
30?
Less than 19%.
Wow.
Yes, knowing the signs and symptoms and talking to your doctor early may help you potentially be diagnosed at an earlier stage. While it may not always feel comfortable to talk about these topics, you can see why it's so important.
Wow. So much information I didn't know. I'm so glad we stopped to chat with you.
Wow, that was pretty sobering. Dr. Pothuri, what is one piece of actionable advice that women listening in on this conversation can take?
Yeah, so I think the most important thing is listening to yourself and your bodies and understanding the signs and symptoms of endometrial cancer. So just to review, any irregular vaginal bleeding, any bleeding in menopause, and that could be any spotting, pink, brown, even just once. Pelvic pain or discomfort that's persistent. And then any irregular vaginal discharge. It doesn't have to be even bloody. It could just be a clear, serous discharge. We've heard from the panel today that endometrial cancer can affect younger patients, older patients, and there's a wide range of patients that are at risk. And so understanding also your risk factors and, paying attention to those, but also knowing that just because you have a risk factor doesn't mean you're going to develop endometrial cancer, but understanding that really will give you more knowledge and a greater ability to advocate for yourself with your care team. There really is no embarrassing symptom, just like there is no stupid question. We all should be open about this dialogue.
Yeah, don't wait. Don't be afraid to ask. Don't hesitate if you see something that's, different, things are happening. So don't doubt yourself. Just go with your gut and fight for yourself.
Absolutely, I agree 100%. You have to know your body, and if something seems to be off, you need to be willing to go get it checked.
Knowing your body is most important. You have to know your body because you know it better than anybody.
Right.
But at the same time, you can't be afraid to speak up. You speak up, you advocate for yourself, and you do whatever it takes to get the information that you're seeking until you get it. Right. Don't stop until you get it.
And, it's really such an honor to be here with all of you to have this conversation. And I hope we can all educate everyone to really be open and discuss these signs and symptoms freely.
Thank you all so much for your time and vulnerability today. The purpose of this project is to break the silence, shake off the stigma, and get the support you need. And this panel really embodied that. Please give yourselves a round of applause. I want to especially thank our patients, Shakeya, Denise, and Hattie, for your vulnerability, sharing your incredible stories, and empowering other people who are hearing this today to have conversations with their families and their healthcare teams. Dr. Pothuri, your knowledge and insight, we are so grateful to you for everything and your time today. Thank you so much. For our viewers today, please stay connected to your body and your healthcare team. Know the symptoms, start the conversation, ask the questions. Speaking up could save a life. To learn more, visit don'tbeembarrassed.com.